Hey John, heads up.
Thanks, Greg. Hey guys, fellow classmate here, John Davis. And today, the crew is going to tell you a little bit about posterior cerebral artery stroke. The posterior cerebral artery stroke is a condition whereby the blood supply from the posterior cerebral artery is restricted, leading to a reduction of the formation or function of the portions of the brain supplied by that vessel. The occipital lobe, the inframedial temporal lobe, a large portion of the thalamus, and the upper brain stem and midbrain. Blockages of the proximal portion of the vessel produce only minor deficits due to the collateral blood flow from the opposite hemisphere via the posterior communicating artery. In contrast, distal occultations result in more serious complications. Visual deficits such as agnosia or cortical blindness may be a product of ischemic damage due to the occipital lobe. Posterior cerebral artery stroke is less common than stroke involving the anterior circulation. There is an estimate of 5 to 10% of ischemic strokes in the United States involve the posterior cerebral artery or its branches. While stroke is the third leading cause of death in the United States and the leading cause of adult disability, death from PCA stroke is uncommon and would more likely occur in the setting of a second brain stem infarction. Stroke is more common in African Americans than in white or Hispanic population in the United States. 58% of patients are male and 42% are female, with the mean age of stroke being 61.5 years. Stroke incidence dramatically increases in the elderly population secondary to cardiovascular disease. Over to you, Zach.
Thanks, Beast. A stroke in the posterior cerebral artery is caused by a restriction of blood to the posterior cerebral artery, obviously. Areas affected by the posterior cerebral artery strokes include the occipital lobe, the inframedial temporal lobe, a large portion of the thalamus, and the upper brain stem and midbrain. Symptoms of the stroke vary depending on severity and location. Blockage in the proximal portion of the artery causes minor defects. This is because of the blood flow from the opposite hemisphere. In contrast, distal blockage of the artery causes more serious damage. Some of these causes include visual effects, such as agnosia, which is whenever our eyes are unable to process sensory information, prosopagnosia, which is the inability to recognize familiar faces, and cortical blindness, which is total or partial loss of vision. All the defects listed above occur in the occipital lobe. Damage to the inframedial temporal lobe can cause little, if not complete, hearing loss. The upper brain stem, often known as the pons, controls sleep, respiration, swallowing, bladder control, and much more, all of which can be affected by a posterior cerebral artery stroke. The thalamus controls sensory motor signal relay, but I'm not saying anything sports majors don't already know. Now to Connor for more sports.
Oh, hey there. I was just researching posterior cerebral artery stroke and rehab. Would you like to join? With posterior cerebral artery stroke, rehab is an essential part to a healthy recovery. It's also worth noting that each rehab program should be individualized according to the person's severity and their symptoms. But in general, right after the stroke, the person will be in intensive care. Here they will be monitored for brainstem damage, severity of their symptoms, and other tissues that may be damaged. Specifically, they're looking at myocardial infarctions or heart attacks. The main goal of this stage is to get many of the essentials as close to the normal range as possible. This includes, like you can see on the slides, normalizing blood pressure, normalizing blood glycogen levels, decreasing the swelling and pressure in the brain, and so on. The patient will stay in this stage until they are considered medically stable. In most cases, as soon as the person is stable, they immediately start a more intensive rehab program. The goal of the rehab program is to increase range of motion, increase activity level, increase the person's ability to perform activities of daily living, prevent future disabilities, and promote an overall healthy recovery. Like I said earlier, it is important that the rehab program is individualized so it's helping that person's specific symptoms. In many cases of posterior cerebral artery stroke, the individual may experience motor symptoms such as weakness, hemiplegia or paralysis on one side of the body, painful contractures of the limbs, possible cognitive dysfunction, or speech and language problems. The earlier these symptoms are addressed, the better the patient will respond and more improvements will be made. For example, painful contractures of the limbs can be managed by stretching. The severity of hemiplegia can be decreased by promoting movement on that affected side. And often, if the person can't move that affected side, they'll use isokinetic machines or machinery in order to start the movement. On top of that, physical activity can improve muscular strength and balance, which will decrease their risk of falling, and it will improve gait dysfunctions. These people may also experience cognitive dysfunction or confusion. This can be improved through a variety of cognitive exercises for rehab. They may also experience difficulties with speech, which can be improved through speech therapy. Therefore, a lot of these symptoms can be improved through physical exercise and rehab. However, in many cases, these patients will also be medicated in order to prevent the reoccurrence of the stroke or the further progression of any of the conditions associated with it. Some of the more popular medications used for this condition include anti-stroke prevention or stuff like aspirin, cholesterol lowering drugs, blood pressure lowering drugs, muscle relaxants, medications, and more. Now, off to Greg.
Thanks, Gunnar. Now I'm going to talk to you about some predisposing factors. Any type of blood clot can directly lead to a posterior cerebellar stroke. Bleeding or trauma, especially in the posterior neck close to the cerebellum, hypertension, smoking, elevated fat, elevated bad cholesterol, LDL or lipoproteins, any type of heart disease, and type 2 diabetes. Lastly, we can quit smoking. Smoking accelerates clot formation in a couple of different ways. It thickens your blood and it increases the amount of plaque buildup in the arteries. Along with a healthy diet and regular exercise, smoking cessation is one of the most powerful lifestyle changes that will help you reduce your chance for a stroke. So what does it look like when somebody's having a stroke? I'll tell you. First, we want to see specific changes in the eyes. The eyes can tell a lot about somebody having a stroke. The stroke in this artery can stop the messages sent from the eye to the brain. It is common to lose part of the field of vision. Somebody may complain about not being able to see, not recognizing things, and not being able to focus. Next, changes in memory. Like Zach said, prosopagnosia is a very real effect of somebody having posterior cerebellar arterial stroke. They may appear as confused, they may not know where they are, they might even be acting different than you know them. First is changes in judgment, and then changes in alertness and focus. Their brain may be foggy, they might, like I said, they might not know where they are or where they're going. Changes in body movement. The changes in movement or weakness can be on the right or left side of the body. It depends on where the stroke occurred. When the body is unable to coordinate how the muscles move together, it is called ataxia. For example, you may fall because you're not able to put your foot where you want to walk. Lastly, is changes in speech. Somebody may not be able to pronounce words or not know where they want, so that would be a change in judgment. Now let's go check out what they're up to in here.
Oh, hey, Greg.
Thanks, Greg.
Thank you for watching. Stay classy, GU.
Took you a minute.